Hello. I am Jessica, and I currently live in Lincolnshire in the UK. Um, I my husband is in the Navy, and we moved here about a little over 2 years ago. Me and my husband and my two daughters. Um, I have a associate's degree in medical assisting. I worked in the medical field, mostly front office, um, for nearly 10 years. All of my job history has been in the medical field. Um, I am now attending the social work undergrad program and hoping to move on to get my master's in social work. Mostly because I found in the medical field that there was it's lacking some room to advocate and to treat the person as a whole. And I have had one amazing doctor that I worked for that encouraged us to think of our patients as complete human beings, not just someone to fill that 15-minute appointment slot. And I really admired that. And so here I am. I have, like I said, I have worked with some really diverse populations in the medical field. I have worked with developmentally delayed adults. I have worked with developmentally delayed children. I have worked with minority groups and lower income groups. I have worked with some military, some LGBTQ plus, as a part of the medical system, as a cog in that kind of system. I have learned to be able to work with just about every group and kind of push personal biases aside because I was there to do a job, and that's how I kind of take this as. I have volunteered in a few different capacities. I have volunteered with victims of sexual abuse in the past. I was an assistant to a pastor when we were living in Augusta, and there I worked and advocated and helped people in the community in Richmond County. Yeah, I've done a lot of things. I know, but I've also had a pretty limited career. I have big gaps in my resume as a military spouse. That happens moving around and things. But on a professional note, I would like to see myself working with trauma victims and with the military and those who suffer with PTSD and things like that. That's kind of where my heart has been for a long time as a survivor of trauma. I think that I could offer a unique or maybe a understanding perspective to someone who is also living with with the aftermath of trauma. With that said, I also want to make sure I have the proper training. And so I would like to get my master's degree. I would like to get my clinical licenses and be able to practice. I would prefer to be in more of a clinician type of position. I'm I'm sure I'll need lots of education and training for that. But I think I would like to work mainly with adults, just knowing myself. That's where I see myself being the most help. I am looking forward to this class, mostly as a history buff. I kind of find these sort of things interesting and fascinating, how things evolved and how things came about, and knowing how policies and systems are where they are now. And then, of course, modern issues and how they affect us in everyday life, and how they will affect our clients, and how these can, and how these will affect us in practice, right? And how we will have to learn how to navigate within those issues. So I am looking forward to this class. I am looking forward to working with the rest of this cohort. I have enjoyed the last couple terms with them. And I am ready to go even in this quarantine. So yeah. Thank you for this opportunity. Bye.